slide.
Oh, good.
Whoa. Ready? Okay. Everyone want to come and grab a seat if you can? Or in the back is cooler, a little breeze. Well, welcome everyone. Good afternoon. Thank you for everyone to be here today. I'm Lena McDonald. I'm the CEO of MedTrust. We are pleased to have with us today Congresswoman Nancy Mace. Here. Here today are at headquarters at MedTrust. We're going to focus on an important topic, and that is emergency preparedness. Congresswoman Mace represents the South Carolina District 1, our district, and we're so pleased that she's representing us. This is a particularly important topic and timely as we're here in June. It's warm and it's hurricane season. In Charleston, along the coast of South Carolina, our communities must be prepared in the event of an evacuation, particularly for those most vulnerable in our community. One of the most challenging aspects of such an effort for evacuation is the transport and evacuation of folks within hospitals and other healthcare facilities. While there are many agencies and organizations that participate in that effort, it is the South Carolina private ground ambulance organizations that really take the lead, and in particular MedTrust. Over the years and in various events, we have evacuated thousands of patients from along the coast to safety, and we do that in partnership with our hospitals and other healthcare organizations. We regularly set up EOCs, we coordinate our own resources, we coordinate resources from other states. So this is a topic that is important not only to us, but across the state for all of our ground ambulance providers. Our founder, Josh Watts, will talk a little bit more about the role of EMS providers. Following his remarks, Josh will introduce the Executive Director of the South Carolina EMS Association, Henry Lewis. Thank you, Henry, for being here. Under Henry's leadership, the EMS community is really coming together as a common voice, a common view of what's important to the association, but also what's important to the various communities that are served. Henry will have the honor of introducing Congresswoman Nancy Mace, and we are pleased that Congresswoman Nancy Mace has agreed to give some comments on this important topic and make sure that we have sufficient resources for our community in the event of an evacuation or emergency event. After Congresswoman Mace has spoken, Rick Sharan, thank you Rick for being here, Senior Vice President of Duke Energy, will make a presentation of funding to the South Carolina EMS Association to conduct a statewide gap analysis of EMS disaster services. Now, Josh, do you want to come up and make a few comments?
Sure.
Thank you.
Thank you, Lena, and thank you everyone for joining us today. My name is Josh Watts. I'm the founder of MedTrust, and I just wanted to expand a little bit on Lena's comments to help folks understand, if they don't already understand, the role of private EMS as it comes related to evacuation. Every healthcare facility in South Carolina is required by law to have a contract with a private EMS agency to evacuate in the event of an emergency. That responsibility falls squarely on the shoulders of about 110 private agencies in the state. Out of that, obviously those of us along the coast are more exposed. One of the biggest ways that we've accomplished this in years past is through the amazing work of mutual aid, both in-state and through partners throughout the region. One of the challenges today is workforce. We have those challenges here in South Carolina. Our partners in other states have the same challenges. And what I'll leave you with is the concept that you can only come to help if home is safe, which means those other communities that have stepped up in years past and sent 1 ambulance or 2 ambulance or 10 ambulance to us, they are less equipped to do that today, unfortunately. And so that's why something like an ambus that we're going to talk about today really serves as a force multiplier that allows us to use the appropriate number of staff to move 8 to 16 patients per bus at one time. And that's something that we really, as an agency, have been fortunate to use in years past from our partners in the upstate and our partners in the Midlands. But today, there are no ambuses on the coast of South Carolina. Clearly, we're in hurricane season. That brings this front of mind for everybody. We've been busy with planning and talking with our facilities, and everybody is most concerned that we put ourselves in a position of success to move these patients out of harm's way but also to get them back home. Everybody thinks about the emergency evacuation. Not many people think about bringing folks back home. So thank you all for coming. I'd like to introduce Henry Lewis, come up here and talk about the EMS Association and introduce Congresswoman Mace.
You're literally a flag officer.
My job. Good afternoon, everybody. Thank you all for being here. As Josh mentioned, I'm Henry Lewis. I'm the Executive Director of the South Carolina EMS Association. You didn't come here for a story, but you're going to get a really short one before I introduce the Congresswoman. Back in March, we had an event up in D.C., and we met with a lot of the South Carolina delegation. We had an opportunity to meet with Congresswoman Mace. The first words out of her mouth were, "How are you doing and what can we do to help you?" We're ready. You tell us what you need and we'll be there. I think that's evidenced by her showing up and being here with us today. I can tell you that we left her office feeling very invigorated, feeling like we had a lot of support in DC, and we don't always feel that way. So with that in mind, it's my distinct privilege to represent or to introduce Congresswoman Nancy Mace.
I am a hugger. Thank you. All right, good afternoon, everyone. First of all, I want to thank the EMS workers who are here with us today. We want to thank you for all of the hard work. You are underpaid and overworked, and we appreciate each and every one of you for being there for all of us in our most vulnerable times. I also want to thank MedTrust. They are huge here in the Low Country in the state of South Carolina and our region for all of their great work in ambulances and then coming together and bringing awareness today. I was actually shocked when I learned from MedTrust and others that the Low Country, the coast of South Carolina, we don't have a single ambulance on the coast to help us in an emergency situation. Ambuses, for example, can carry between 8 and 16 patients at a time. They can evacuate individuals, especially our most vulnerable, whether those are patients in hospitals, nursing homes, other medical facilities, senior living, etc. They can get them out of harm's way and then be able to bring them back when the emergency is over, because according to state law today and federal law, that when they get evacuated by ambuses from other parts of the state or other states during an emergency, they're allowed to do that. Private ambuses are, but they're not allowed to bring them back because of the time the patients come back or the people retreat back, the emergency is over, so they're not allowed to actually use those services, which is to say a lot about the government and how backwards and upside down sometimes we do things, how stupid we are when it comes to this. We want to work smarter, not harder, and we want to make sure that we are doing everything we can to find the funding and resources available. We have a great partner in State Representative Mark Smith, who's also championing the cause today. So thank you, Mark, for being here today and representing District 99. But this is an issue that at the federal, the state, and local level, we can truly work together on. Emergencies and hurricanes do not see political affiliation. We only see emergencies when we need to get people evacuated, get them out of here, and get them back home safe and sound. And so from our perspective at the federal level, we see a lot, and we saw some articles this week, but we'll often, Republicans and Democrats, we argue over the amount of money we're going to spend. We argue what it's going to be spent on. We argue over how it's going to be paid for. But at the end of the day, we want to make sure when those dollars are authorized, when they're appropriated, that we're getting our fair share, because the Low Country in South Carolina's 1st Congressional District, this is the 10th fastest growing district in the nation. So that means more communities and more populations who are more vulnerable than ever. We have more nursing homes, more patients that are in hospital care, other medical facility care, more nursing homes, et cetera, more senior living facilities. All those things exponentially increase when you have the kind of growth that we have seen over the last few years. And so I want to make sure that we're putting this issue on the radar, that we're working with our state and federal and local partners on this issue, and that we're making the community aware of this is a need. And I would encourage everyone in the Low Country to call their lawmakers. You've got me, we're on the team, but to call their state lawmakers, call their local lawmakers, and encourage them to learn more about the issue and help us, find those resources, because we will be there for you each and every step of the way. And I just want to say thank you again. Our office is open, mace.house.gov. Thank you.
Or do you want to go ahead?
Yeah. So just a couple of things we wanted, in talking with Josh, we wanted to also bring about the South Carolina EMS Association is very unique in that we are the unified voice of public, private, air, ground, hospital-based, fire-based. And in recent years, we've now committed to moving into the disaster preparedness space because there are a lot of unmet needs there. EMS is often underrepresented, not because of anything that's malicious, just simply because of the fact that we're not at the table telling our story. I'd also like to echo the Congresswoman's remarks. Thank you, Representative Smith, because you have been a huge supporter of EMS, and we've got tremendous support across the state. Our organization is here to help you advocate, and as part of that, we've been working to address some unmet funding needs. With that in mind, I'd like to welcome to the stage Mandy Gaddis, our project coordinator. She does a lot of grant writing for us. We have now moved into a new space to where the South Carolina EMS Association is now the single asset with South Carolina EMD, ESF 8, and DHEC that is going to be responsible for EMS mobilization. That's going to be a huge lift, and we couldn't do it without partners like Josh and MedTrust and your team. So thank you guys for helping us and guiding us through that. And Mandy?
Thank you, Henry. So, as he said, my name is Mandy Gaddis. I'm the project coordinator for the EMS Association. We are excited to announce that we have received a grant from the Duke Energy Foundation. We are going to perform a gap analysis to do coastal evacuations during hurricane season. So, with that said, I'd like to introduce the Vice President of Local Government and Community Relations, Rick Duran from Duke Energy.
Well, I only asked for a minute because if you're from here or from this area, the first thing you might be asking yourself is, why is Duke Energy here? Because we do not serve this part of the state. We're an upstate utility. However, we recognize, of course, that emergency management and all the agencies that support emergency management are true partners. All utilities want the lights on 24/7. It's not a luxury, it's a necessity. The grid needs to be strong, things need to be done, and part of our partnership when there's large storms, hurricanes, etc., means that we need to partner with folks like y'all. And I think Congresswoman Mace said it perfectly when she said, hurricanes and large storms do not know political affiliations. Well, guess what? They don't know boundaries either. They don't know municipal, county line, state line, utility lines. They don't know. So Duke decided this year to have, as our second year of a campaign, this year we decided to expand it statewide. So we're granting this month 32 emergency management grants that will end up totaling $500,000. And like I said, we wanted to push that beyond our own service territory to recognize that emergency management should not have boundaries. So it is our pleasure to donate the cost of this gap analysis at $17,500 to South Carolina EMS Association. So thank you.
Thank you, Rick. I would like to introduce now Jeff Straub. He is with Leeward Solutions, and we are partnering with them for this gap analysis.
Good afternoon, everyone. I appreciate your time and energy, and particularly to Duke and the EMS Association, the opportunity to abide by this high order. I have just a brief history about who I am. I've worked in this industry for over 30 years as a emergency manager, as a paramedic, as well as now a business owner in South Carolina. I've been a recipient of those coastal evacuations in my former life at a hospital. We know what that feels like. I've been an EMS provider transporting those patients. We know what that feels like. So we think we're going to bring a lot of useful information and hopefully a lot of gap analysis and data back to the state so we can make some improvements. And so when we need to move patients during hurricane seasons, it's not painful. Everybody's going to be a partner to this process. We look forward to the endeavor, the challenge, and we will be here to help you throughout the entire time. Thank you for your time and energy. Appreciate you.
Thank you. Could we get a picture with the check and Duke? Yeah, and Henry in front, yeah, because I think otherwise the podium is right in the way. Mark, please. Definitely, let's go ahead and get a picture, and then once that's done, if we could do also a picture in the